Part 2, we examined how patients benefit and healthcare costs are reduced when physicians and hospitals share medical information. Barriers inhibiting medical information sharing, the nation's options for a healthcare economic model, healthcare reform, and healthcare rationing. Within the context of these issues, doctors and patients, as well as a physician attorney and a healthcare economist, describe the characteristics they believe EMR systems must incorporate if they are to operate effectively and efficiently.
To maximize our efficiency in healthcare, to avoid errors, and most importantly, to avoid repetition, I think that every person touching a patient as a provider should be able to access the entirety of their medical record.
I think the biggest benefit from a national perspective is the idea that physicians, hospitals will be able to communicate with one another. And I think we're very, very far from that because there are so many different types of EMRs out there.
I think HIPAA's a mess.
I've never seen HIPAA do anything for anybody. It's caused, obviously, a tremendous mess and killed a lot of trees.
When HIPAA first came out, it was a huge nuisance, and still is to a degree.
HIPAA's tough. HIPAA's tough for everybody. I personally think we're better at complying in the electronic realm than we were in the paper realm.
There are many issues in my particular field that have to do with confidentiality. I mean, some of the things that I do as a practitioner are highly confidential.
Now, it has some good points to it. For one, the public is more comforted knowing that there is a strong law in place that we have to abide by. That's a good thing. It is a problem, though, with sharing of information, but there are two sides to that issue. There are two sides, and you can't have someone needlessly affecting other people in society when that could have been prevented easily by appropriate precautions.
My fear is, where do you set the limit? Those people who have access to this information, they can start to use it for genetic selection, job selection, who knows, credit, maybe your ability to get a particular kind of job, or maybe a particular training. I don't know where it ends.
The patient comes second when it comes to financial viability of any business or hospital institution. The patient's going to be second. The healthcare dollar is first. What kind of dollars can come in? EMTALA had to be passed in the mid-1980s because hospitals were pushing away uninsured. That's the moral and ethical implications here. We have to always have a law that forces us to deal with our morals and ethics in this country. There has to be a mandate from our government to integrate the electronic medical record into our everyday practices. Just like EMTALA reshaped the way that we do business with the uninsured and the underinsured and patients who present to this health safety network in the emergency department, Congress now has to take it a step further.
If healthcare is a social good, data is owned, controlled, and used for the collective good by the government. If healthcare is an individual good, it belongs to, should be controlled by the individual economic actor. In this country, essentially, it's a 50-50 proposition. The feds fund about 48% of healthcare costs, 52% is private. So we've never really decided one way or the other. It's going to be very difficult to determine how information is collected, stored, controlled, and accessed until we've come to that decision of whether healthcare is an economic good or it's a social good. That much of the focus now is on the way healthcare is financed. How are we going to pay for it? The real issue is the pattern of consumption, not how it's financed. 5% of the people in this country consume 50% of all healthcare resources. You cannot argue logically one side of the issue or the other. It starts with a question of values.
Healthcare costs have been rising at an unsustainable rate for years and presently consume 16% of our economy. If we're going to stop this trend, medical experts will have to make hard decisions about which treatments will be available, when such treatments offer the best outcomes, and whether related costs are justified. Solid, objective information based on nationwide population groups could empower all of us to access more effective, less costly treatments.